Now, there are lots of questions in regard to cost. Many of them are very simple. How will it be paid for? But lots of them also ask about whether or not there will be incentives for companies that provide comprehensive, affordable health care plans to their employees. Others say, will this legislation increase the overhead for business, either in tax increases or mandated expenses, and just a number of those. So if we could start with Congresswoman Johnson, whether there will be assistance to business incentives for companies to provide health care, and then we'll go to Congressman Sessions.
Yes, there will be tax incentives for insurance companies that provide for the care. And actually, I would say probably 95 to 96% of the population now have insurance. I was very, very surprised to find in my research that African Americans were just as insured as Anglo Americans, which did surprise me. I thought they would be on the bottom of the barrel like they usually are. But I think that when somebody is working and they get the coverage, naturally the company that's offering it deserves to have some type of remedy for what they're paying out, because usually the employee pays half and they pay half. That's the way it was when it started out. It's getting worse now. But if we don't make this change, don't give insurances more responsibility for the money they collect, then all we're going to be doing is going deeper and deeper in hole. Many of the foreclosures that have taken place here in this area is because of health care costs and the loss of jobs, and when they lose the job, they lose the insurance. And that's another thing we're trying to do. In small businesses, certainly will be more tax incentive. If they, and there will be a way in which they can pay a certain percentage when they cannot allow every single individual the same kind of coverage as a large number of people in an insurance plan. For the most part, people that work on jobs where they have a large number of employees are fairly young. They don't use the insurance plans that much. That's all a cash cow for insurance companies. As people get older and get ready and retire, they don't have to deal with the donut hole. Medicare becomes the first payer. So the most of that is going to be paid by Medicare. That's a federal public program that is paid for by people who work and put money in Social Security. And so the insurance companies don't take on the responsibility that they should. And that's who they want to insure, young people that don't get sick. When you pass 40, 45, or get into 60 or 65, you're going to be on some medication if you're alive. That's when they start. That's when you lose that protection of any kind of reduction. I take Synthroid, and I research, and when I retire, hopefully I will before I die, I will have to increase what I pay for Synthroid 1,500% when I'm not in a group. That's unconscionable. And that's what's happening when people get to the point where they have to have insurance. It's often not there in that particular way. So when you talk about a public plan, let me assure you that when people get 65, Medicare becomes the first payer. And they will have paid into this insurance company all their working lives, like I have in Blue Cross Blue Shield, Texas.
Thank you, Congressman Johnson. Can we stop there? We're running out of time. Congressman Sessions.
Thank you very much, Cal. I believe every Republican believes that we should allow a person when they're 20, no matter what their age, to be able to get the health care that they would have and keep. They would be able, through the opportunity to have the tax incentives, to be able to save their money year to year, not lose it at the end of the year. It would grow in an account called a health savings account. It provides them interest on the money that sits in that account, and they can allow it to grow 5, 10, 15, 20, 30 years as they go from 20 to 40 an opportunity to have children, or perhaps need it in other medical areas. The free market works, and it works well. We have too few people in that free enterprise system. And the reason that we're having problems is that my friends up in Washington don't want to give the same tax advantage to all individuals. If they would give that to all individuals, then everyone at the age of 20 or whenever they want on their own health care could have the advantages, yes, that I have and others have. And then we would all, through our own savings, our own pain, be able to have a system that works. Because we have that problem in Washington of giving individuals that tax advantage, we are now going to a federal or socialized medicine government-run plan. This means that the legislation talks about a federal health board in Washington, D.C., who would determine exactly what the benefits package and cost-sharing agreements would be for the public, for individuals, and for employer plans that are in America. It would allow the federal government unlimited access to every single business in this country to come in and audit their books to find out exactly how much money they make and what they are paying for health care, or what they should be paying for health care. It will place an 8% payroll tax on companies that do not meet the government guidelines of what the government wants. It will raise taxes $818 billion. It will lose 4.7 million jobs. And perhaps worst of all, it will accelerate Medicare going broke. And as the Congressional Budget Office just said on July 17th, it will increase the federal long-term deficit of this country dramatically.
Congressman Sessions.
That is not a system for the future.
Let me break in. That sounds like a closing statement, which is going to come up here pretty soon. I do have one more question that I want to get in, and we